Okay. Technical difficulty.
Okay.
Okay. My bad. Let's try this one more time. There we go. Just to make sure. Okay. Here we are. Okay, good evening, everyone. Thank you so much for joining us on today's session with Dr. Gaj, a general dentist. I'm Desiree. I'm a part of the Dental Shadowers e-board. And thank you so much, Dr. Gaj, again, for taking time out of your day. And the floor is yours.
Hi, guys. Thanks for having me. It's a pleasure to be on here. My name is Dr. Gaj, and I am a general dentist practicing in Houston right now. And yeah, let me kind of tell you a little bit about myself. So I'll go to the next slide. So I was born in Zambia. I moved here when I was about 7, and I've been in Houston most of my life growing up. Graduated or studied in Houston, or studied at Austin and the University of Texas, and then I went to Midwestern in Chicago and graduated in 2018, and I've been working in Houston ever since. Currently, I'm doing private practice in Houston. And I did corporate practice when I first started off for about 6 months, and then I transitioned into private. So I'll go ahead and go on to the next slide. So, journey to becoming a dentist. I basically shadowed dentists since high school, just kind of going around working for different dentists and just seeing how different dentists were. And then when I got into undergrad, I decided to go to the pre-dental journey. So I was a science major, and I took business foundations just to have kind of like a side thing, knowing that in the future, if I were to own my own practice or anything, that'd be a good thing to kind of have on my shoulders. I tried to get involved in as many extracurricular activities as I could during my time in undergrad. So I played soccer. I was in the pre-dental society. I was in the Muslim society. And then I did a couple of other things just on the side, including working at Apple, which helped a lot in other aspects. Long story short, I feel like if you can work and do other stuff on the side, I think it's definitely a big plus, especially when you do apply. They like to see that you're able to juggle a lot of things around while you're also studying. I did apply 3 times before being accepted. So hopefully that'll be a little note for anybody that's reapplying or has already applied and is nervous or anything about it. Like if anything happens, don't worry, you can always reapply. Don't ever feel don't feel like you're like it's over after the first application or anything. There's always a second chance and third chance. I did take additional courses between the times that I did apply, just because I think it's good to show the dental schools when you're applying that you're still focused on trying to get there, and you want to kind of show them that you still have that motivation and drive for it. So I'll go ahead to the next slide. All right, sorry, are you supposed to ask me any questions or anything, or I can just kind of go through these?
You can go through these if you want to, or if you want me to ask the title, I can do that too.
No, that's fine. I'll just go over that. I just wanted to make sure I wasn't interrupting anything.
No, yeah, it's fine. The floor is yours.
Okay, so in terms of DMD and DDS, I get that a lot. There's no difference between the two. So when you are applying, if that's ever a concern to you or ever a question that you were concerned about, just know it's the same thing. So if you're trying to get a DMD or DDS degree, it doesn't make a difference. DMD means Doctor of Dental Medicine, or Doctor of Medical Dentistry, and then DDS is Doctor of Dental Surgery. So just keep that in mind. If you want to shadow a DDS or shadow a DMD, it's the same thing. You'll still get the same experience shadowing either of those. I'll go to the next slide. So a typical day in my office, it's my private group practice is a little unique in that we work in a lot of lower income areas. So we do work with a lot of patients that um, either haven't seen a dentist in a long time or haven't been to a dentist period. So I do tend to do a lot of extractions, root canals, things like that. Um, so that's something to keep in mind is when you do graduate, there are different venues of dentistry that you can go through. Some like to go the cosmetic route. Some like to, go do more for one type of procedure. So you do have that kind of freedom to decide, and it also depends on where you work and the area you work. So in my case, since I work in the lower income areas, um, it's a group practice that's been around for over 6 years now. So it's pretty well established. So I don't have to worry about much in terms of doing much else besides dentistry. So I just review the schedule when I come in the morning, and everything else is pretty much set up by the staff. I have really awesome assistants at every office. And I do work at multiple offices. I worked at 5 offices total. So every office is different in terms of the staff and also just how everything is set up. So I just kind of got used to that over time. Usually it's one doc per office. Sometimes there's two. Because it's a group private practice, I'd say there's like 7 or 8 total of us. And the main owner, he kind of floats around too. So every now and then I'll get to work with him. But for the most part, it's just me in the office by myself. My schedule is typically 10 to 6 every weekday. And then I like to work on Saturdays. So I'll work 9 to 1 on Saturdays, mostly because that's when I can do a lot of treatment, or I can just see a lot of patients that typically can't come see me during the week. So if you do have the opportunity to work on Saturdays, I would say when you're first starting off, it's a great way to get more experience. And also the way I see it is I would have just been at home not doing much on my Saturday mornings instead. So why not get more experience and also, make more money on the side while you're just being able to work in the morning. The one thing I would say is when you do first get out, you'll learn in dental school too, to try to maintain the habit of looking at your patient's medical history before every exam or before any treatment, just so you can kind of always be on top of things, because even when things do get busy, you never want to forget that patient you're seeing is a person, and they do have history and they do have medications that you have to keep in mind. So sometimes you can get into this routine of just jumping into the room and doing stuff, but you have to kind of set yourself back for a second and make sure that you're prepared before you walk in that room, just because you don't want anything to go downhill and not be prepared for that. Because at the end of the day, anything you do is on your license. So it's really important that you always kind of keep that in mind. The only last thing I'll say about typical days is lunch is optional. The reason I say that is sometimes when it gets really busy, um, there can be days when you don't get breaks in between. So you just have to kind of keep that in mind as well, to just try to pace yourself and not overwork yourself. If you do get a chance between your breaks, try to make sure you're staying hydrated, make sure you're eating, and try to remember that you got to take care of yourself as well as your patients. Because if you aren't in a good state of mind, or if you start getting weaker, if your blood sugar goes down, that's going to also affect how you work on patients, because a lot of the stuff we do is physically demanding. So try to keep track of all that. This is the next slide. Kind of complaints my patients present with. So like I said, because I'm in a lower income area, it's a lot of patients who don't typically come to the dentist, and a lot that can't afford dentists, so they typically avoid them. So because of that, I do tend to do a lot of treatments at once when I see them, because oftentimes I don't know when I'll see that patient again. So I try to do as much as I can just for their sake, and also for my sake, in terms of knowing that I can at least take care of that patient while they're with me. I do see a lot of kids. So again, with the kids, I always try to take care of as much as I can before they leave, including, doing as many sealants as I can. Usually, even if they have lesions on or cavities on their baby teeth, usually we tend to go towards doing more stainless steel crowns, because those kids are high risk individuals who eat a lot of candy, eat a lot of fast food, tend to brush their teeth very little. So a lot of our treatments tend to be a little bit more aggressive for those kids because it's more long lasting. So that's another thing to keep in mind is whatever offices you do work in, your treatment plans can vary based on the population you're treating. Of course, every dentist has a different opinion, a different outlook on that regard. So I wouldn't take everything I'm saying, um, to stone, make it like it's not exactly the right way to go, but it's the way I've been doing it and the way I was taught to do it. Um, but everyone has their own way of approaching it. I do see a lot of emergent cases. So by emergent cases, I mean, emergency patients who have infections or injuries, like kids falling, breaking their teeth, getting injured from fights, and patients that have had a lot of dental past that, they're from another country or they had treatment done in another country that was not very good. And now they're kind of paying for it. So we try to fix a lot of that stuff too. And with this year being the way it's been with COVID, I have been seeing a lot of patients who have basically avoided a dentist for like the last couple of months. And a lot of infections are rising and a lot of serious issues are coming up because they've been kind of avoiding the dentist for so long. So I'm seeing a lot more of that lately. All right, next slide. So kinds of procedures I perform. So I pretty much do a little bit of everything. I would say that most of the time I'm doing a lot of pediatric dentistry, a lot of cosmetics, so like aesthetic stuff, veneers, crowns, Invisalign, and I am doing a lot of endo when patients obviously need to get root canals done or um, kids need pulpotomies before we put the stainless steel crowns on their teeth. So pulpotomies are kind of like the mini versions of root canals you do on kids before you put stainless steel crowns, especially if the cavity starts to touch their nerve or cause any infections. Um, I haven't done any implants. We have a periodontist who places the implants in our office right now. So with those, they place the implants and then I do the crown right after. So that's kind of nice because we have a specialist in-house who helps us with that. And yeah, in terms of the only I'd say I do is when we have basically a complicated denture case or a complicated case like dealing with your TMJ or any other jaw related issues, and we can refer it out to a prost who can kind of help us or guide us along that. Go ahead and next slide. For diagnostic tests, so the main thing before any treatment we try to make sure is we have good x-rays, so bite rings and PAs. So that's just basically the standard x-ray machines you see in all offices. Panel machine is always good just to have for diagnostic purposes for any patient. And obviously my loops and loop light, once you get into dental school, it's important you get one of those. There are dentists in the past that have gone their whole career without using those, but they significantly help your career if you start using one at an early age. Perio probe, that's mainly those little sticky, pointy things that they kind of poke you with a little measuring ruler on the side that kind of helps us diagnose if patients have any gum disease or anything like that. Digital camera and now your phone basically can be used as one, and that's what we use not only for diagnostic purposes, but also if you want to do ortho or Invisalign treatment, we use that to take pictures and send it out for treatment planning. And obviously, your fellow dentists and specialty providers are another good diagnostic tool. So if you're ever looking at something and you're not fully confident in what it might be, or if you need a second opinion on something, it's always good to have somebody that you rely on or somebody that you trust at least to get a second opinion on and work besides. And we'll go to the next slide. For new technology, so I haven't used, I mean, there's so many, there's like an endless array of things, but in my experience so far, in the 2 years that I have practiced, I've been using the iTero for Invisalign, which basically helps us scan digitally and create 3D renders of the arches to send out for Invisalign. And you can use it for other purposes too, but that's what we use it for. And Surrey CAD/CAM I used during my first few months out of dental school, and also while I was in dental school, we had those, and they're basically like a digital built-in lab where you can make your own crowns, and it's pretty cool because it kind of cuts out the middleman of having to send it to a lab. You can basically make it in your office, but they're also very expensive. And CEREC stands for Chairside Economical Restorations of Aesthetic Ceramic. So it's a lot to say, but it's basically a state-of-the-art tooth builder. So it's pretty cool. The Oroscoptic Spark, that's what I use for my loop light. It's a wireless loop light. I don't know if I have it with me, but I could show you. Here it is. I think I have it with me. So it's not attached right now, but this is my loop light, and this is a little battery. It's pretty cool. You just basically attach it here, and I don't know if you can see that, but yeah, and there's a little loop light with the filter, and this is what I use. I usually attach it to my loops. I've been keeping it detached for now just because I use it also with my face shield, which is really important with everything going on right now. But these are my loops. They're just standard Surgitel loops, and then I attach this loop light to it. So if you do get a chance, I would say when you're in dental school, it's important to make sure you find a loop light that you really like. And usually the loops and the loop light come together. Sometimes you can get two different things like I did, mainly because I got tired of the wire and I wanted to get something wireless and lightweight. So it was a little bit more convenient for me, but it's all personal preference. And the last thing I use is a Wave 1 Endo. That's what I used a lot in dental school. It's basically like the high-end rotary machine that we use to do root canals. If you've ever had a root canal, it's that drill that moves really slowly. You might have felt it or heard it in the past, but this is basically like one of the nicer ones, and just makes root canals a lot easier. So the thing about dentistry is there's a lot of stuff out there. There's a lot of machines. There's multiple types of every machine you can find. You just have to do your research and talk to other dentists. And also you get to go to a lot of conventions and meetings, and you get to see all this tech in real life and talk to the salesmen and stuff. So it's definitely something you want to kind of keep in mind, that beyond just dentistry, you're going to have to start learning about just the tools you use for dentistry that can make your life a lot easier. And sometimes it's worth the investment. Like, for instance, my loop light, it's a little bit more pricey, but it made my life easier in terms of being able to jump into procedures without dealing with the annoying wire in my way and stuff like that. So just, yeah, to do your research while you're in dental school and also when you get out of dental school. Next slide. All right, so important terms in dentistry. I didn't think it was necessary to get into like complex terms because that's something you'll obviously learn in dental school, but this is like pretty general stuff. So DMD, like I said, is Doctor of Medical Dentistry. DDS is Doctor of Dental Surgery. And these are like the main specialties in dentistry. There are a couple more, but these are the main ones that you tend to typically come across. So orthodontist, those are the ones that deal with braces. I did write down like the technical term of all of them. So orthodontics is a specialty of dentistry that deals with diagnosis, prevention, correction of malpositioned teeth, jaws, and misaligned bite patterns. And that's something you do about 2 to 3 years specialty school for. So after you graduate dental school, you have 2 to 3 years of basically like a residency and school combined to become an orthodontist. For endodontist, endodontics is the dental specialty concerned with the study and treatment of the dental pulp. Again, that can be, I say like 2 to 3 years because some schools can vary, but typically it's about 2 years. And yeah, that's after you do dental school. And those are the guys that do the root canals, obviously. Periodontist is a dentist who specializes in prevention, diagnosis, and treatment of periodontal disease. So like I said, we have the periodontist who can also place implants. That's something that a lot of periodontists do. And yeah, they're definitely useful to have in your practice and just useful to know, because they're so helpful with a whole variety of things. Oral surgeons, they're basically like I personally think they're like the badass of the whole specialties. They go through, you go through a lot more school, you go through a lot more in terms of just residency and everything, and you're able to do a lot more. So obviously they're surgeons, so they can do, I mean, the definition here is intense. It's like surgical specialty focusing on reconstructive surgery of the face, facial trauma surgery, the oral cavity, head and neck, mouth, and jaws, as well as facial cosmetic surgery. So they can do a lot, and they're definitely good to have on the side if you ever need help, doing biopsies or getting second opinions on things, or even if you aren't too comfortable doing extractions or anything too complicated, they're always good to have on close call. Like I said, just like periodontists and even, ortho and endo, but oral surgeons, I think, are definitely like a number one priority you should consider having if you're a general dentist practicing anywhere. Prosthodontists, like I said, they're kind of like the smile makeover people. So they help you if you have complicated cases with dentures or anything that you think you might need help, if it's a super complicated case you're doing. So definition again is specializes in the aesthetic, restoration, replacement of teeth, and restores optimal appearance and function to your smile. Basically give this smile makeover. And obviously pediatric dentist is pretty standard definition in the name, is a dentist that works on children. So even though I do work on kids, I do tend to refer a lot of complicated cases to pediatric dentists because a lot of the times if they're a sedation case or a kid that just isn't really being cooperative, a pediatric dentist is always somebody good to have with you. And a lot of dentists don't actually like working with kids. I really love working with kids, but on the small chance that when you get out of dental school and you realize you just are not a fan of working with kids, it's always good to have a pediatric dentist on call. So we'll go to the next slide. All right, so advice for college, I'd say study something you love because the major doesn't really matter. What matters is obviously you take the prereq classes for dental school, what's required, but you can honestly take anything you like. I know a lot of kids that had different backgrounds in terms of what they took in college and they still got into dental school. So don't let that get to you too much. The only reason I took science is because I really did like bio, so that worked out for me. But at the same time, I would say that looking back, if I could have taken something else, I probably would have. But I think I just kind of like got too scared to try anything different. The plus of taking a science course like bio or anything else is that a lot of the prereqs are built into that major. So you don't have to worry about trying to take stuff outside of it. Like I said, get involved, try to do extracurricular activities if you can, because while grades are important, I think it does really reflect on your resume or CV when they see that you've done stuff outside of school. So if you can volunteer, shadow, join organizations, obviously this is stuff you've all already heard, but just to reiterate that, I'd obviously don't stay in the library. And that includes like, just, enjoy your time in undergrad, like go out with your friends when you can, try to spend time with your family when you can, like try to maintain a balance if you can, because if you can learn it then while you're in undergrad, it's really important that you also develop that in dental school and in life in general. Like me being a dentist now, it's really important that I learn how to balance my work and personal life, because you can easily burn yourself out And when that happens, it affects you, it affects your work, it affects your business because of your work, and it affects how patients see you. Like, patients will know, or they sense when you're just overworked or tired or exhausted, and your body starts to also see the reverberations of that. So I would say just try to learn how to balance everything at an early age. That way you don't have to worry about it later on. Networking is important, super important, especially as a dentist, because a lot of your career is based on, getting to talk to people and building connections with people, whether it's dentists or patients. So if you can develop that at an early time in college, it helps a lot later on too. Shadow and work when possible. Like I said, that adds a lot to your CV and application. Apply early. The best thing about applying early is obviously you don't have to worry about it later on. Like if you procrastinate and do it the very last minute, your chances of also getting in are also a lot lower, just because just think about how they accept people and kind of like in an orderly process. So when they start reaching towards the last applications, they've already accepted like the first couple of students in the first cycle. So the earlier you are, the better your chances. So that was pretty important when I was applying, and I feel like it's still pretty important now, especially because of how competitive it's getting. So the earlier you apply, the better your chances are in general. And also that way, you have to worry about it less. Once you send everything out, you can just breathe and, enjoy the rest of your semester in school and not stress too much. Take the DAT as soon as you can. Goes the same with applying early. Balancing, I already mentioned that, super important. And just enjoy college. Like, I loved my undergrad experience. Like, I plan to move back to Austin as soon as I can, just because I really love living in that city. And I made some amazing friends while I was in undergrad, and I think I got really lucky because I went to the school that I really loved, and I managed to take classes with professors I really loved, and I made some great friends there. So I think that really is important to your mental health. I think it's really important to enjoy your time, because it also makes the whole process of all of this a little less stressful. Because I think at some degree you need to be happy with what you're doing and not let it get to you too much, because your mental health will significantly affect how you study and how you do with all this stuff. So just try to stay positive and enjoy yourself while you're at it. I'll go to the next slide. Okay, so this is basically the cases we're going to go over. So I guess we'll open this up to whoever's here or can talk. I figured instead of showing like cases I've done, it would be cooler to discuss this case with people and then kind of go over it like we do in dental school. So in dental school, what we do usually is we would have a case like this, and then we would have us treatment plan it based on what we think was necessary or what we think the right sequence of treatment options are. So I'll open it up to you guys if any of you guys want to give any input or have any questions about it.
Okay. So I see that, I guess, these are fillings, if I'm correct.
Yeah. So
Okay.
obviously, I'll just say starting off, what our professors were most adamant about was how you read an x-ray. So what they recommend is starting in one corner and then going kind of like in a direction. So every time you look at an x-ray, you start at one section and you go across, and then you go down, and then you go. So what I would do is I would start on the top left, go look across, and then go down, and then go left. So I kind of scan everything before I make a diagnosis. So what I'll say, I guess I can't. Let me see. Can I draw on here? I think I can. Let me see.
I think you can.
Okay.
Yes, there you go.
Can you see that? Okay.
Yes.
Let me undo that. Okay. So the first thing I will tell you is this patient she is in her 50s, or elderly lady, and she came in because she's interested in getting dentures. So obviously she's had some stuff in the past done, and I'll just kind of indicate what's what. So these right here, let me see if I can. These are crowns. So obviously you can kind of see the outline of the crown. Uh, and these little shapes are how the teeth were prepped to put the crowns on. So that's first thing I noticed. Obviously she's had some anterior crowns placed. She has a root tip here, which needs to come out. So anytime you see these in a patient, you want to take those out because they're just broken down teeth, and we call them root tip because they're just the tip of the roots that serve no more function and are just more likely to cause infection if they're left in the mouth. Over here, she has a bridge that was placed, and obviously you can see that the bridge has now broken in terms of the tooth supporting the bridge on this side, so they're not even attached anymore. So obviously that would also be a root tip now. So first thing that was my biggest priority is obviously getting these two root tips out, and then because this bridge is no longer serving a purpose or function, you can either take off the entire bridge or you can actually just section it right here and leave this as kind of its own crown. Sorry, this is getting super messy. Let me move everything off. So yeah, so that's another thing. Do you guys know what these are back here?
Are they the wisdom teeth, the third molars?
Yeah, so they're her third molars are obviously have been there her whole life. So do you guys think I should take those out?
Well, the one on the bottom right is impacted, but there are no teeth there. So I don't know if that makes sense.
Yeah, so it is technically impacted, but the thing is, because she's over the age of 50, if their wisdom teeth have been in there, their whole life, haven't caused any issues, and in this lady's case, aren't causing any issues right now, there's no teeth adjacent to them that are getting any cavities or any infections, you usually want to leave them in there. And the reason is at this point in their life, as they get older, the risk is greater to try to remove these teeth. So just keep that in mind is age plays a big factor in your treatment planning, obviously, and you want to kind of keep that in mind. So that goes along with what I said earlier is the patient's medical history. You want to keep that in mind. Another thing to keep in mind is when the wisdom teeth are like this, you can't see it with her because she's older. But there's usually a little nerve that runs along here. This is called the inferior alveolar nerve. And if those wisdom teeth are anywhere close to this nerve right here, you need to really consider whether it's worth taking out. And you can kind of see the outline over it, overlapping the tooth right here. And if in that case, you definitely don't want to mess with it because if you do damage that nerve in any way, that patient can lose sensation to their entire right side or left side of their jaw, depending on which one, if you do damage that nerve. So you want to take that into account too. So a lot of your treatment planning is trying to decide whether the benefits outweigh the risks or vice versa in terms of what you're planning to do. So that's another thing to keep in mind. So and let me just try to see. So the other thing I would say is, can you guys see these roots? See how they're kind of thick right at the bottom? So usually root tips are pretty generally thin, like they're usually like that. But in this case, the patient had really fat root tips, which is not normal. So the reason this happens is called hypercementosis. And it's basically a type of, it's something that can happen for a lot of reasons. And it happens a lot as they get older. And as you can see here, this is the root tip I took out. So this is this root tip. So root tips are usually not that thick. They're usually pretty thin and they are relatively easy to take out with not a lot of force. But because this one had hypercementosis, um, it gives it this kind of like chicken drumstick appearance, and it's a lot harder to take out. So that's another thing you have to just keep in mind is as patients get older, sometimes if that happens, it does make extractions a lot harder. And that's why these panos or x-rays are really important because they help us understand, even before we're going in there, what to expect. Let me see what else. Is there anything else you guys see that kind of stick out to you or anything you're concerned about or have questions about?
Somebody in the chat asked if those are amalgam fillings.
Yeah. So the way to tell a difference between a standard filling and amalgam filling is the amalgam fillings have this kind of white, just basically like it's like a shining white, and that's because they don't they absorb the I forgot the terms, but long story short, if you see that, you know it's an amalgam. The reason these are having that same appearance is because it's actually metal under the bridge. So the outside of the bridge is made of porcelain, and then the inside has like a metal base layer, and that's what you're seeing right there. But that's not amalgam, that's just the metal portion of the bridge. As you can see, these kind of have the transparent appearance, and those are the crowns. But you can see that little white part right there, that's actually the cement inside of the crown. So that kind of helps us understand when we are looking at radiographs, we can kind of see what restorations are done. And you will learn that in dental school, how to kind of differentiate between different restorative procedures. And then right here, can anyone tell me what that is in there, in the root tip?
Is that left over from, or I guess part of a root canal?
Yeah, so that was a pre-existing root canal. This patient probably had a crown that cracked off or broke off at some point, and so that's the remaining gutta percha inside of the root canal. So when you get a root canal done, the gutta percha, they purposely put a certain material in it that gives it that appearance, so that when you do take x-rays, you can immediately see the material in there and you'll immediately know that it had root canal done on it. So what happened is they probably had a root canal done. They probably got decay underneath their crown, and over time the crown, just like this one, had decay underneath it and started breaking down the tooth and separated the crown from the tooth. Except in this case, because this bridge was attached to another thing, it didn't just completely fall off. It remained stuck on this entire restoration. And the problem with this, and the reason why this bridge needs to be sectioned off as soon as possible, is because it kind of acts like a cantilever, which is basically, a cantilever is when a bridge has only one support, only one point of support. So in this patient's case, they're pretty lucky. They don't have an opposing tooth hitting on this section, but you can kind of think of it like a seesaw. If I keep hitting this one seesaw continuously, it's going to put a lot of force on this tooth and eventually damage this tooth. So usually you want to avoid that, because not only are you basically putting a lot of force on here, but you're damaging this tooth over time. So that's just something to keep in mind. You'll probably hear that term at some point in dental school, but cantilever bridges are a no-go, especially in my opinion. What else?
What is on the radiograph below the mandibular incisors? What is that white thing there?
So I want to say this is technically the spine in like the back, because basically you're looking at a flat view of something, and this is just, you can see a lot of aspects of the patient's like skull. So right here, you can see the sinus. You can see the sinus right here. This would be the spine over here. And then right here is a little, it's basically like a little sensor that they're biting on when they're taking the pano. So when they bite down on this, the pano goes all around them. And while it's going around them, I don't know if you've ever seen a pano machine working, but it goes around the entire head. So it's kind of getting a scan of everything from, you know, the left side of the ear to the right side of the ear. And along the way, it kind of catches, obviously, the base of our, or the point where our spine touches the base of our skull. And just to give you a heads up, one last thing I do think is important is this little maxillary sinus floor I mentioned. You can kind of see the lining of it. This is really important because when you're ever considering doing an extraction on a patient's upper teeth here, you want to be very cognizant of where this maxillary sinus floor is, because if there's ever a chance of you breaking this lining, you do have to go through a lot of extra steps, because that's basically can cause a lot of complications down the road. So that's another thing to keep in mind. Like I said, that's why panos and diagnostic x-rays are important, so that you can kind of assess things before you plan extractions. You can't just go into doing an extraction without seeing if everything's safe to do. Like I said, you know, the IN here, the maxillary sinus here, you know, even small things like you want to make sure that they have enough bone to begin with, because you could easily fracture their bone if they're elderly, or if they don't have enough calcium in their system. So that's another thing I think you'll learn a lot about in dental school, but I think a lot of people don't realize that that's why we really value x-rays and panos before we do exams to begin with. Because I know a lot of patients, especially nowadays, tend to be anti-x-ray, and you know, they refuse to get certain things done. And some dentists do kind of give into that. But when you do give into that, you put yourself at risk for cases like this, because you might not see what could cause problems down the road. Okay, so I'll go ahead and go to the next case just to kind of switch it up a bit. So this is kid's x-ray, obviously, because you can see some extra teeth there. And this is good diagnostic x-ray when you want to kind of get an idea of not only how old they are, but also how their teeth are kind of coming out, and if everything's going along in order as expected, or if you see anything out of the norm. So the main thing I wanted to kind of point out was that I made the mark earlier, but this was a case of where it's important to have x-rays, and I wanted to kind of reiterate that, because some parents are iffy also about their kids getting x-rays. But in this case, I was able to tell when one of their adult teeth were not had not extruded correctly, and there's a little bit of a discrepancy in their bite. So when that is the case, you can kind of show it to the parent, and the parent can also understand that their bite here is pretty normal, but they have an uneven bite here. So in that case, you can do it yourself if you want, but in this case, you would want to refer it to an oral surgeon to kind of luxate the tooth, or kind of extrude it a bit more, because the roots are fully formed in this case, and you want to even out that bite, especially for ortho reasons. Can anyone guess how old the patient is? I know it's a tough question, but just based on what adult teeth are out, or can anyone at least tell me how many adult teeth are out right now? And it's okay to be wrong, because these are the best ways to learn anyway. So
I only see the 2 molars. There probably could be more.
2 molars. So
maybe the front teeth, the bottom front teeth.
yeah, you're right. Good job. Yeah. So obviously this one is, here, let me see if there's a better, okay, so this is an adult tooth, this is an adult tooth, this is an adult tooth, this is an adult tooth. So you already have 4. Those are usually the first adult teeth that come out with kids. So those are the first molars. The incisors here, like you said, are permanent teeth. And then there's one here that basically is a little bit earlier than its neighbor. So usually in this case, what I like to do is I would tell the parent that I want to extract the baby tooth right there. And the reason I want to do that is because I want those 2 front teeth to kind of balance themselves out when they're coming out. And it kind of saves the kid from having to get more ortho treatment done. But yeah, so overall, you're correct. You had all the 4 incisors on the bottom, and then the 4 molars on the 2 on the top and 2 on the bottom. And then obviously you can see all the adult ones on the bottom here haven't fully formed their roots. They're still coming out. So everything here is pretty much in order and going normally. The only thing is just that one baby tooth that needs to get extracted on the top, which I recommended to the parent, and we had it taken out and everything was pretty normal. The only other thing I would definitely say is important with kids like this is I usually like to get sealants placed on patients. So sealants for kids are, I'm sure you've all had them as kids. The reason we put those is to prevent or to lower your chances of getting cavities. And they're kind of like fillings we put on the adult teeth right when they come out, because I like to explain it kind of like you having like fresh pits that are just so prone to having sugar or breads or anything stuck in those little gaps, and the sealants kind of seal them up just like you would with like caulk on a wall and make sure that nothing gets in between those little cracks. So that was the main treatment we had for this patient. We had a little extraction done on that little baby tooth just to even out the adult teeth. And yeah, we usually do 3 to 6 month follow-ups for these kids, just to make sure everything's kind of going according to plan in terms of the adult teeth coming out. And yeah, and then we can plan ortho if that's the case. We can always keep that in mind. So in this patient's case, you know, if let's say this canine is still up there, but everything else is out, we can oftentimes refer it to an oral surgeon to help extrude that canine out, or we can send them to an orthodontist to kind of have a plan of action. So again, another reason why having x-rays is super, super important. And that's why I thought these 2 cases were a lot more interesting to show radiographically, because I think that's pretty much the first important course of action you take with patients before even going into the room and looking at them clinically. You want to kind of get a radiographic idea of how everything's looking, and then you can confirm it clinically when you go in the room. Did any you guys have any questions or anything?
Some people in the chat were guessing that the patient was around 6 or 7 years old.
Yeah, good job. So this patient, I think, was 7 years old. The reason is because once you turn 7 to 7.5 is when you get your first permanent molars coming in. And then after that, well, usually 6 to 7, but I like to kind of overestimate. And with a lot of patients, we tend to notice that girls tend to mature quicker than guys, both mentally and physically. So with these teeth, you can see that the permanent molars did come out earlier than planned. So this was a girl in this case. So yeah. And then the only other thing, let me see. I wish I was going to do another case showing the SSCs for the kids, but I've completely forgot to take the picture of it. But yeah, with kids, especially around these ages when they have their baby teeth, you never do, or you typically, it's not advised to do fillings because if you look closely here, you can kind of see how small their baby teeth are and how thin their enamel is. So the enamel is obviously the outer coating of, the outer protective layer. And as you get your adult teeth, the enamel layer is a lot thicker. So doing fillings is a lot more, it's a lot more something that you can rely on for a longer time. Whereas if you do it on kids' baby teeth, since there's not much enamel for the filling to hold on to, those fillings do tend to fall out a lot more, along with other issues like kids, salivating a lot when you're doing the fillings, interfering with the whole bonding process. So that's why you typically see kids having those silver crowns a lot more, because those are a lot better for the longevity of the tooth versus doing the filling on a baby tooth. Okay, did you guys have any other questions or anything? No? Okay, we can go to the next slide then. All right, so final advice is just stay focused on your goal. Don't let anyone, don't let any naysayers tell you that you can't do it or tell you all the stats against getting into dental school, any of that stuff, because that's just not going to help. Just focus on the positives, focus on why you deserve to get in there, and try to keep that in your mind, because you will get in. You just have to kind of keep at it and, not give up on yourself. Make sure you do it because you love it. Like I know a lot of people say, I have met people in the past, dentists that don't love their job and they just did it because their parents made them do it, or because, they were kind of trying to pick a course and they just picked this just because it had money or whatever. But at the end of the day, you're going to be doing this for the rest of your life, and you worked really hard for it. So just make sure it's something you're really passionate about. And I think I really did think about this stuff a lot, even when I was studying, because I needed to know that me sitting in this library till 1 a.m. in college is worth it. And I think luckily I did work with dentists that were really passionate about their job, and they really showed me the beautiful parts of it. So if you can find dentists that are really passionate about the job, it can really help you. So, try to look for a dentist to shadow that are really excelling in their field and are excelling in it usually because they love it too. Obviously you're not going to see a dentist doing amazing because he hates it. It's usually a dentist that's really into what he's doing. So that's always good to kind of keep in mind. Again, just try to have a mentor, same thing. I've had a mentor in every stage of my life, whether I was in undergrad and dental school, and even now, I still have mentors that are older dentists, professors I had in dental school, and even people that aren't dentists, but they're just people that I look up to. I think it's always good to just have somebody there to kind of help guide you when you have questions, and somebody that can serve as kind of a motivation or an influence on you, or a good influence on you at least. And never let complacency get the best of you. The only reason I say that is even when you do get into dental school, don't get too comfortable, because you still have a long way to go. And even when you graduate from dental school, don't feel all right, I'm a dentist now, I can sit back and relax. You still have a long way to go in terms of, there's a lot of challenges that are going to start coming, and you just have to kind of keep fire under you. And that's also just when you get into a dental practice and let's say you see all this money and you're okay, I'm great. But if you keep pushing yourself, you're going to not only get more, but you're also going to enjoy it more, because you're going to get more out of your profession, and you're going to really see the positive aspects of just pushing yourself harder every time. And it just makes every day just a lot more interesting, instead of, just kind of sitting back and saying okay, I did everything and now I can just kind of relax. So I think that's just the main thing I've noticed is complacency is the worst part of becoming a dentist. Is you tend to come across a lot of people that got lazy over time, and it affects not only their work, but just how they are as a person. So you work this hard to get there, so don't let that take advantage of your success once you get out. Okay. You guys have any other questions or anything? Sorry if that was a lot of talking and wordy stuff.
No worries. Thank you so much for your informative session. We do have a couple questions.
Yeah.
The first question is, what is one thing you wish you knew before starting dental school?
One thing I wish I knew before starting dental school. Sorry, that's like I guess I've never had that question before. That's a good question. I would say I wish I knew like I wish I knew how to enjoy it more, like how to kind of take it a little bit more as an experience and not like another step in my life. Like I feel like I treated dental school as like the next stepping stone to becoming a dentist and not an actual like um, experience that I should savor. And I did learn to savor it, through the small moments, because I met like some of the most amazing people. I met some of the most amazing professors and dentists that I still keep in touch with and look up to now. But I think at the time you're so focused on like that end goal that you don't get to experience or you don't get to enjoy it as much. And I know it's hard to say that now because everything in hindsight looks a lot easier to, think about. But I think once you get in, just try to savor the small moments if you can, like your first test that you pass, the first filling that you do, the first anything, like try to take those moments and really like savor the fact that you accomplished this little goal, and try not to like keep looking at the next thing, and thinking in the future. I think that was just something I really regret not enjoying more.
Thank you. Did you ever think about specializing, or did you know that you always wanted to be a general dentist?
Oh, I definitely wanted to do oral surgery, and that's why I was really like passionate explaining that, because I really loved oral surgery and I really still love oral surgery. Like I do little bits of it here and there, but not a lot. And I had an oral surgeon in dental school that like I had an amazing relationship with. She was a really big mentor to me, and she still is. Like I still keep in touch with her. Um, but I think the big deterrent for me was the school. I think I was so ready to just get into the field and start doing work. And I got really anxious about that. And I think that was what swayed me away from it. But if I did do any specialty, I would have for sure gone into oral surgery.
Interesting. Thank you so much, Dr. Gaj. It
Yeah,
was a
no
pleasure
problem.
having you, and thank you for your informative session.
Yeah, no
I will
problem. Thanks for
send,
having me.
yes, of course. For everyone watching, I will send the link to the attendance quiz right now. But thank you for joining us, everybody.
All right, thank you so much, Dr. Gaj, again for joining us and for taking time out of your day to be here and to make this presentation. And
Yeah,
thank you,
no
everyone.
problem.
Thank you, everyone, for tuning in today. Like Kathleen said, the quiz will be up for an additional 12 hours for those of you guys who couldn't join us live. Make sure to join us on our next session, which is Wednesday at 4 p.m. Eastern. Thank you, everyone, for tuning in tonight. I hope you guys have a good night.